Florida Pain Network, where we connect those in pain to pain relievers throughout the state, including pain clinics, physical therapy practices, and chiropractic doctors. The topic today is your low back pain coming from your low back? And it's a very interesting topic because recent studies have shown that 25% of the time, pain in the low back is not being caused by the low back, which is very surprising because people think that if they have low back pain, there's something wrong with their back. And in fact, 1 out of 4 patients, that's not the case. So let's talk about what is coming from the back. What about that 75%? Well, in older individuals or those who are younger who have premature arthritis, arthritis is the problem. The facet joints are these little thumbnail-sized joints on either side of the back at every level, and they have the propensity for arthritis just like your hip or your knee. They have cartilage, it's a mobile-bearing surface, it can get arthritic, okay? So that's the number 1 cause. Others may include degenerative disc disease in younger patients, 20 to 50-ish. So when that happens, the disc is the shock absorber between the bony vertebrae. 80% water normally. As we age, you start to lose some water, the disc degenerates, and it may end up with some tears. Now, due to genetics or whatever, job or car accident or what kind of trauma the person's experienced, they may have degenerative disc disease that is much harsher than other folks and may have chronic pain as a result of the tears and the pain that accumulates, okay? So those are the 2 main culprits, plenty of others, but let's talk about the 25% outside of the low back causing low back pain. The biggest culprit that pain doctors see is sacroiliac joint issues, okay? Sacroiliac joints, and there are 2 of them, there's one on the right and the left below the low back in the buttock area, all right? And that's where the pelvis meets up with the sacrum and the joint kind of goes like this on my right, and then there's one on the left as well, okay? They have cartilage, the joints see between 2 and 4 millimeters of movement, so a little bit, but enough to cause pain if there's arthritis in those areas. And a person who has an SI joint arthritis pain may go like this. It may get better for a few months, then it may get worse, up and down, and it can lead to low back pain. So one study recently showed that 12 to 25% of low back pain is coming from the sacroiliac joint, okay? So another reason that a person may have low back pain, but not a low back problem, is the hip. A hip can be arthritic, it can have a cartilage tear, which is known as a labral tear, or a number of other issues, but that can lead to low back pain. And the question is why? Well, it can refer pain up to the back. It can alter the way a person has to walk to have less pain. They can be limping, they can have a little bit of a list, and it can cause low back pain. So a person may not completely realize that that's what's going on. Usually an astute pain doctor will be able to delineate that between the exam, the x-rays, maybe a diagnostic injection. That can usually ferret out that the hip is the source. Now, there are other issues that can happen in the lower extremity as well. Like if you have knee arthritis or you have ankle arthritis or a foot problem, it can alter the way that you walk and it can cause low back pain. It can put excess stress on one side of the back and cause some issues. So it really should necessitate an in-depth history with the pain doctor to try and figure out where is the exact problem coming from, because it may very well not be the low back, all right? So there you have it, 25% of low back pain not coming from the low back, all right? Check us out at floridapainnetwork.com. If you need a pain doctor, just click on Pain Management Doctor. The ones closest to you will show up first. There's also chiropractors and physical therapy practices on the website. If you need further assistance, don't hesitate to call us at 877-877-8556. I'm David Greene, CEO of the Florida Pain Network.